Good afternoon, everyone, and welcome. This is the Emory Cognitive Neurology and Integrated Memory Care Clinics MCI Dementia webinar series. I am Alice Cooper Salisbury, a licensed clinical social worker in the Cognitive Neurology Clinic. I'm joined by my colleagues Ashley Varner and Debbie Arnold. During this time, these are topics that are relevant to MCI and dementia that have been brought to us by you. And so we're hoping that you enjoy this series. Today, the topic is going to be guidance when hiring care in the home. But a few housekeeping details first. This is a webinar, and so you are not on screen as participants. You will not be on camera, and also your audio is not enabled. But we do want you to participate, so please put your questions in the Q&A box and do it during any point in time during the session, but they will be answered at the end of the session. So please, we want you to participate. So put those questions in the Q&A box down, usually at the bottom of your screen. And also just remember that these are being recorded and they will be uploaded to our YouTube, I think it's our YouTube channel. There is a link that was in the invitation that was sent to you via email. So if you did not get that link, please let us know. All right, and I'm going to turn it over to my colleague, Debbie.
Hey, I am so excited for our speakers today, and I'm going to try not to take a lot of time, but I'm really looking forward to hearing from them. And if you have not had the pleasure, you are in for a treat. Kara Johnson is an MSW and a CMC. She joined Aging Life Care of Atlanta in 2018. She has a bachelor's in religion and philosophy, as well as a master's of social work with her concentration in aging. She has worked at a variety of places and spaces as a director of an adult daycare, as a social services director in an assisted living memory care, in skilled nursing, and as a care consultant and early stage programs manager with the Alzheimer's Association Georgia chapter. Kara has a love and interest for assisting families and individuals dealing with a diagnosis of dementia. Her own grandmother had Alzheimer's, which was the catalyst for her interest in improving this journey and the caregiving experience. Her education, her experience, and her love of seniors form the foundation for her ability to aid families and seniors through the changes of late life. And Michelle Allen is a licensed clinical social worker who began her career in geriatrics in 2003, working in a hospice organization. And since then, she has become fully licensed in the state of Georgia, worked for an elder law firm, a psychotherapy practice focusing on older adults. And in 2019, she became an advanced social work case manager, and she joined Aging Life Care of Atlanta as well. Michelle is dedicated to helping older adults and their families create long-term plans, communicate their wishes about aging and dying, to navigate the confusing maze of health and long-term care providers. She advocates for care, good care, and coping with major life transitions. And she has a particular passion when it comes to how laws, regulations, and policies affect real people. And she focuses on using this interest to get the best care possible for her clients and their families. We are just privileged to have them join us today.
Thank you so much, Debbie. We're so excited to be here. And Kara and I both are working for the same agency as geriatric care managers. And so what we hope to do today is share with you all just some of the tools and resources that we have found to be very helpful when helping people bring care into the home. this is important because just as you are probably all experiencing, this is no shock to you, right? That 88% of adults ages 50 to 80 feel it's important to remain in their homes for as long as possible. So this is usually the point at which Kara and I do meet clients and families as they're trying to figure out how to age in place at home. And one of the things that we always begin with our clients and with families that we're working with is that caregiving is a team sport. And we've got to expand everybody's support team in order to really make aging in place or staying in home successful. And we are very fortunate to be in the Metro Atlanta area because we've got lots of different options for care in the home. So over the next few slides, we're going to be going over some of these various options for care in the home. Caregivers, companions, daily money managers, household services, meal delivery, home modification, adult day, care management, and hospice. And as we are going through this, please feel free to add questions in the Q&A box, and we will address those as we go.
Thanks, Michelle. Thanks, Debbie. So probably the number one area of interest for people is traditional caregivers when it comes to what kinds of support services are in the home. So we're going to start there. And there are a variety of different types of caregivers, family caregivers, of course, as well as agency caregivers and individuals that fall into a category that is not family or agency. So we'll talk a little bit more about that. Home care agencies. We've all heard of home care agencies. We've all been in doctor's offices and seen brochures for different home care agencies and wondered a little bit about what it is that they provide if you haven't used one. And so in general, home care is a professional service that provides assistance and support to someone in their home setting. So it can be a home setting, by the way, as you can see, can be a private residence, independent living, or assisted living setting. You can have home care services in skilled nursing, but in that area, we're not going to talk a lot about this. There's not a lot of services that home care agencies can provide, and hopefully there's not a lot that's needed in a skilled nursing setting. I did a Google search this week just to see how many home care agencies were in the Metro Atlanta area, and it's over 350 at this point in time. So you may see the same brochures over and over again in doctor's offices, but there are a lot of options for home care agencies. And there are a lot of pros and cons to going with a home care agency. So talking about the benefits of a home care agency, that would include management and administration. So you're working with somebody else who's going to be hiring aides, who's going to be firing them if needed, paying their taxes, hopefully providing criminal background checks, doing reference checks for these employees, and providing oversight, education, training, liability insurance. These are all the nitpicky things that come up when you are an employer that home care agencies manage behind the scenes, where you as caregivers don't have to get involved. And sometimes there are mitigation areas too, where if there's a dispute or something happens that's a little bit uncomfortable, you have somebody you can go to, a manager, and say, I've got this issue, can you handle it? And you're not responsible for that. One of the biggest things too is continuity of care. If somebody is sick and they're coming to you from a home care agency, we hope that they have let the agency know, and the agency has provided a backup home care aide to come in their stead so that you're not left in the lurch. And then again, liability insurance, workers' compensation, those things are super important because people who are assisting with lifting and other personal care tasks may indeed get injured on the job. And if they're coming through a home care agency, that protects you as the primary caregiver from liability related to that injury. And again, when I'm talking about home care agencies and caregivers that work for them, there are a variety of different caregivers. So I'm using really generic terms here, but caregivers through home care agencies are usually certified nursing assistants, which we call CNAs. But sometimes they are also companion care providers. And those are people who don't provide personal care assistance with caregiving tasks like bathing, dressing, grooming, but they provide socialization and stimulation, and maybe light housekeeping and things like that. So light meal prep can also fall into the realm of what they offer in both categories. So either one, you would benefit no matter what kind of caregiver. If you're using a home care agency, you would benefit from the administrative services that are provided. Some of the cons to using a home care agency might be that, yes, you have coverage if somebody calls out, but maybe there's a lot of turnover. Maybe there's difficulty with scheduling and you're seeing a lot of different caregivers come in and out of your house. That can be frustrating for both you and the person receiving care because it's hard to get used to someone. It's hard to change and educate over and over and over again when you have a lot of turnover. Some agencies work really hard to pair you with somebody who's going to be a very good fit, and some agencies have less availability in care providers. And that might be because of the region that they're trying to serve, or because, as we all know, there's a lot of staffing shortages in the healthcare industry right now. So you may have a lot of options about who's a good fit with your loved one, or you may not. So that might also be a negative. And agencies also usually cost a lot more. Individual care providers who are not working with home care agencies can set their own rates, and sometimes those can be as much as half the price of a home care agency. In the Atlanta area, we're running into, and correct me if I'm wrong, Michelle, home care agencies are between $25 and $32 an hour on average, and a lot of them have an hourly minimum. We used to see way back in the day, I think it was like a 3-hour minimum and then a 4-hour minimum. And now we're seeing some agencies have had to go up to 6 and 8-hour minimums. And the reason for that is staffing shortages. People really want those bigger chunks of time so that as professionals, they're having a steady and consistent schedule and income flow. Michelle, anything you want to add to that?
No, I think that was very comprehensive.
Okay. So a quick note on the next slide. I want to make sure we differentiate between home care agencies, which is what we just talked about, and home health care agencies. These two names sound so much alike, and yet the word health is the differentiating factor. So home care agencies assist with activities of daily living, or ADLs, bathing, dressing, grooming, light housekeeping, light meal preparation, often a certified nursing assistant, but sometimes a companion care provider. And it's really the routine day-to-day things that they're assisting with. That's home care. And that is paid for privately. Home health agencies are certified Medicare and Medicaid providers, and they are providing skilled services. So they may have some certified nursing assistants that come in and provide services, but they also have RNs and nurses that come in, physical and occupational therapy, speech therapy, and other limited services like medical social worker, things like that. So these are health-related medical providers that provide assistance primarily to homebound individuals. And again, home can be in a private residence or it can be in an assisted living type setting. It's usually not consistent. So, and by that I mean they're going to be coming in maybe a couple of times a week to do therapy. The nurse will come in, depending on the task, once or twice a week to provide education and assistance with specific things like wound care or ostomy care and education. And then once they feel like they've met goals, this service will stop. It's time limited. And again, not focused on day-to-day personal care, but it's really about meeting health-related goals. Private caregivers. So we know what it looks like for agencies to send certified nursing assistants or companion caregivers out. We know it's expensive, but there's pros and cons. There's also the option of hiring somebody yourself privately. And of course, pros and cons to that as well. So they may or may not be trained. There's plenty of certified nursing assistants who keep up their certification every year and decide that they don't want to work for an agency, but they want to work for themselves. There's absolutely a million great reasons that they might make that choice. It doesn't necessarily indicate that they're a bad employee or anything like that. They may make more money working independently. They may have more flexibility with their schedule, or there may be a number of reasons that they prefer it. So don't be deterred, I think, if there's a certified nursing assistant that chooses to work independently from an agency. So some of the benefits of hiring someone yourself would be that a lot of times these people establish a really strong relationship with you and your loved one because there's a lot of continuity of care. If you've hired somebody privately, they may be the only caregiver that you're working with. And a lot of times these individuals can become like family. That's not to say that that same thing doesn't happen with agency care partners. It certainly can, but it's more likely to happen when the caregivers come on a very consistent schedule. And of course, it costs less usually, not always. And I do encourage my families who choose to hire someone privately to pay a competitive rate, not only to retain the caregiver that they're working with, but because this is a very hard job. And I really believe that we need to pay our caregivers as well as we can. Some negatives to hiring somebody yourself would be, of course, if your caregiver is sick, if your caregiver has to go care for somebody in their family for a while. There's a lot of unforeseen reasons why somebody may be out, and then you may be left scrambling trying to fill in those care gaps. The other thing is that you're going to be the one responsible for hiring, payment, education and training. You'll be responsible for any sort of awkward disciplinary events that might come up. None of that is going to be handled by anybody but you. And so sometimes for people, it feels like you've traded off caregiving responsibilities to just become a manager. And the burden doesn't really feel lighter. It just feels like you've shifted. You may have to pay taxes. You should pay taxes for your caregivers. You will need to follow up on their licensing. You may want to do your own criminal background checks and screenings, and you may be liable for any injuries that happen on the job. This is just another aside because this is something that has started coming up a little bit more. And I want to make sure that you guys have heard this term, proxy caregivers. It's somebody who has gone through a specific training from a skilled nurse so that they can provide a specific maintenance service to a client. So these examples I think are good ones. A regular home care agency does not typically do medication administration, which can be very frustrating if you need somebody to give meds once a day. Some home care agencies are not able to do that. And negotiating somebody to come out and do that separately can be quite a chore. If the agency allows training from a registered nurse or an LPN, then you can sign on a form. There's a link to the form at the bottom of this slide that says, I'm allowing proxy caregivers to be trained in this area, and then they can do that task, even if they're not a skilled nurse. Ostomy care, catheter care, tube feedings, insulin injections, basic wound care. I myself have been trained as a proxy caregiver for some wound care for one of my clients because it needs to be done every couple of days and it's easier for me to just do it. But I received that training from a wound care clinic nurse, and then we follow up regularly to make sure that things are moving in the right direction. So something that can be taught by a specialized provider and is part of a routine service can fall into this proxy care category. Excuse me. Okay, well, how do you even go about finding caregivers? Of course, there are brochures in the waiting rooms. But word of mouth is the best way to find good caregivers. There's a lot of good resources, as Michelle said, in the Atlanta area. And we do have, in addition to an enormous number of home care agencies, we have some really good locally owned ones. And Caden Home Care is a good example of one that provides good care and is locally owned. Griswold, Personal Care Inc. There's a wide number of them. I'm sure that the IMC has some favorites that they refer to as well. If you are a member of a support group, which I hope a lot of you are, because I know that's another valuable service IMC offers there. That's a great way to find out which agencies have worked for other people, if there's specific caregivers that people have hired independently that are good options. Church or faith-based groups, that's another great place to find word of mouth caregivers. Who has a good reputation? Some faith-based organizations have lists of caregivers in their congregation or parish who have served other people in that organization and have done a good job. Senior centers often have a list of agencies that have good reputations in their area. Facebook groups sometimes are a good way to start the search. Care.com is, if you're looking to hire somebody independently. I think it's been a little hit or miss with our clientele when they've used care.com. I want to mention it because it is something that comes up. But I would say if you can find somebody local, word of mouth first, I would encourage you to try that before you try a website. But yeah, I think any time you are looking to hire somebody, you want to make sure that they are in close proximity, so that there's less opportunity for people to not show up also.
So Stephen had put a question in the Q&As that is there any way to screen various home care agencies' qualifications? And basically it sounds like what we're saying is it's really a word of mouth and it's a trial and error. Is that right, Karen?
Yeah, I think so. I mean, sometimes, Stephen, a good home care company will crop up because somebody has had bad experiences and they're saying to themselves, it doesn't have to be like this. I'm going to start a really good home care agency myself. And I know what I need. I know what I'm looking for. And so, there is a lot of growth in this industry and a lot of opportunity for good agencies to start. But I would say, no, we don't have a screening tool, but yes, I would ask around. I think you're right, Michelle. Just word of mouth is probably the best way to make sure that you're weeding out some of the good from the bad apples.
And with 300 agencies to choose from, it sounds like you don't have to put up with poor customer service or not getting your needs met, that you can transition to a different agency, which is hard. I mean, it's really hard to make those kind of transitions, but that there's a lot of choice out there.
There is a lot of choice out there. And it is also really hard and it can feel like a full-time job if you're trying to manage it yourself. So, yeah, I think definitely look for the resources you have at your disposal with the support groups and the other care providers you have, like IMC, and see what they have to say if you're not sure. And what are we exactly looking for? What should we be asking? I always encourage people to start by making a list of things you want help with. If you do not do this, then it's very possible that there's going to be frustration on both ends. And things that you would like help with should be both realistic. If you want them to repaint your house, for example, that's not a realistic ask. So look at the things that the agency can do. Like when we say light meal preparation, there are some people who can cook and there are some people who can't and some people who don't want to and some people who love it. So if that's something that's important to you, make sure that you mention that right away when you're talking about what it is you're looking for. I'm looking for somebody who can do light meal preparation for my loved one. I'll be out during the day. They'd like soup and a sandwich. That is a realistic expectation of what it is that they can offer. Does your loved one like to walk? Make sure you're asking for somebody who is active and doesn't mind getting outside and moving their body. Make sure they're physically able to do that. Do you need a CNA for personal care tasks, or do you really just need somebody who's energetic and engaging and good at activities? That could be a companion provider instead of a CNA, which might also cost less per hour. Make sure that you have thought about personality traits that are going to be good for your loved one. I have several clients who do not want a hoverer. They want to be able to do as much for themselves independently as they can. And they don't want somebody who talks a lot. They're more introverts, quiet. They'll build that relationship and become close with people, but they don't want a chatty Cathy with them all the time. So make sure that if you can ask your loved one what their preferences are, that's of course the best thing to do. But if you cannot, think about what you think will be the best fit for them and communicate that on the front end. Again, we want to be careful and be smart. If you aren't using an agency, I do encourage you to do a criminal background check. You know, we want to think the best of everybody, but unfortunately, things sometimes go missing and people take advantage. So if you have decided to do something independently, then the person you're hiring should be used to the idea of a criminal background check. And if they're new to this state, then you might want to do a nationwide one. Any questions about that?
I don't see any questions coming up, and those are all really good points. The other thing that Carrie, you and I've encountered recently is that some agencies allow their caregivers to transport clients, and some now are not allowing that. So if transportation, getting to and from doctor's appointments or on outings is important as you're thinking about hiring a caregiver, you know, that's an important question to ask is, you know, does your caregiver drive? Can they transport my loved one either in our car or in their car? Do they have a car if we need that? Because that could be a really important point as well.
That's a great thing to bring up, Michelle. Thank you. And also, you know, one of the things that happens a lot is that people bring a caregiver in and they don't have a list of things that they want to be done during the day. They don't have an idea of a daily routine. And so care partners can end up, or caregivers that are hired can end up floundering and sitting on a couch looking at their phone all day, causing frustration for everybody. And a lot of times that's not because they want to be sitting there looking at their phone all day or watching TV. They really don't know how to help when they're getting started. So making sure that you have a lot of communication at the beginning and setting the expectations of, it would really help me if you could do the laundry on Mondays, Wednesdays, and Fridays, Tuesdays and Thursdays, if you could make, you know, cookies together to give to the neighbors as an activity. Start brainstorming on the front end, things that they can do together, and then they'll be able, as they get to know your loved one, to kind of expound on that.
That's great. One question that we always get from people is, how are we going to pay for this home care, right? Because as Kara mentioned, it's, you know, around $30 an hour right now for caregivers, either through an agency or individuals. And unfortunately, we don't have a lot of great options for paying for caregivers. Most people pay for caregivers through private pay. So using their income and assets, tapping into family resources to pay for the home care they need. For people who have long-term care insurance, most long-term care insurance policies will pay for caregivers. It can be difficult and it can be frustrating to submit those claims and to get the long-term care insurance companies to pay for it. But most long-term care insurance plans do cover caregivers. And we're hearing word that Medicare Advantage plans will pay for home care. I personally still have not had a client successfully initiate that. I had somebody that was going round and round and round with their Medicare Advantage plan, trying to get all that in place, but kept encountering hoops that they had to jump through that we could not get into place. And then the person had a medical event that they ended up in a nursing home. So I still have not seen it in action. I don't know if anybody in the neurocog clinic has seen a Medicare Advantage plan actually pay for in-home care. But if it's not happening yet, we know that eventually Medicare Advantage plans should be able to pay for and provide some level of home care. That, from a regulation standpoint, we have had clearance to do that. Did you want to add something, Ashley? Have you seen it?
No, we have not. I have not seen it in the cognitive neurology clinic. I have talked with some folks who have seen it, and it's generally a very small number, like 8 hours per month or something like that. So it's not going to be the answer, but it is a step in the right direction.
Yeah.
And it depends on the Medicare Advantage plan as to which ones are starting to provide that and which aren't.
So if anybody has a Medicare Advantage plan and it's advertised to you that your plan does provide home care, it's just like Ashley said, I mean, take it with a grain of salt for right now. We're not going to hang our hat on any of those plans being the answer for providing the care and support that we need. But I like what you said, Ashley. It's definitely a move in the right direction. For folks who are eligible for Medicaid, we do have the elderly and disabled waiver program. So that's what the EWP stands for, is Elderly and Disabled Waiver Program. That if people are eligible from an income and asset standpoint, they could get this waiver program to help provide supplemental support. That could be up to 40 hours of caregivers coming into the home that Medicaid will pay for. There's usually a cost share associated with that. Right now, we still have to worry about Medicaid estate recovery for anybody who takes advantage of that program, which means that if somebody does use this Medicaid program and they own a house, we've got to make sure we're protecting the house or planning for the house in some way, because the house could be subject to Medicaid estate recovery. So there's some things to look at for the elderly and disabled waiver program. But for those who can access the benefit, it can be a great benefit. We do have a very large wait list for our elderly and disabled waiver program. And unfortunately, one of the things that a lot of us are seeing is that Medicaid is not keeping up with the private market in terms of reimbursement rates for caregivers. And so we're seeing those Medicaid programs not having enough caregivers because they're not reimbursing them the same way that the private pay world is reimbursing them. So we have some problems, but we do have some good groundwork for the elderly and disabled waiver program. And if you need to explore that or want to explore that, I'm sure that any of us that are on this call can help with that, help get you pointed in the right direction. There are county aging services, or in other words, there are non-Medicaid home and community-based services that are programs that provide caregivers to folks in the county. Again, those programs are also underfunded, hard to tap into, but not impossible. And so they should be known about as well. But we could look into the county aging services. We also have VA benefits. So for anybody who is a veteran and is receiving support directly through the VA for their medical care, the VA can also sign them up to get in-home care and support. Also, if you are a wartime veteran or the surviving spouse of a wartime veteran, you could also qualify for an extra pool of money that could help you pay for the caregivers. So if you're a veteran, just know that we could potentially have some options through the VA for paying for in-home care. And then there are a variety of different respite programs that sometimes get these little pockets of money to help pay for just some very short-term home care, just to help give some respite to caregivers. Not enough of those programs. The funding is sporadic, but there are respite programs out there that we might be able to take advantage of. There's another program that is up and coming in Georgia, and I need to follow the legislation, but during this last legislative period, Georgia did pass, and I don't know if the governor has signed it yet or not, but Georgia did pass for us to start a PACE program, which is a program for all-inclusive care for the elderly. A lot of other states have a PACE program, and Georgia, it sounds like, is going to be starting to at least lay the regulation framework for us to have some PACE programs. So I'm really excited about what that could bring to caring for older adults and helping them to stay in their homes. And so we have a long ways to go for that actually being a real option, but it sounds like Georgia is moving in the right direction and adopting, again, what's called a PACE program. That's PACE. So hopefully we'll hear more about that in the future. So like I said, there's not a lot of great options for paying for in-home care. Most folks are just trying to figure out how to pay for it privately. And if you are hiring an individual, you're not working through an agency, it might be a really good idea for you to think about having a caregiver contract in place so that when you are paying this person, it's pursuant to a legitimate contract, even if that person is a family member. So for different reasons, it might be a good idea for you to have a caregiver contract in place. So just keep that in mind as you're on this journey. So one thing that Kara had mentioned earlier when we were talking about caregivers is that you can have a caregiver who is a CNA or a certified nursing assistant who helps with ADL support, right? So the bathing, dressing, toileting, feeding, some of those really hands-on support. Or you can have a companion, sometimes also known as a sitter. And those people are really there for socialization, for support, for supervision, those kinds of things. Ideally, we would also have companions that are great at doing enrichment, right? And providing transportation and maybe helping to run errands. But when we look for a companion just through an agency or through an individual, a lot of the folks who are interested in becoming caregivers are really there to help with the more hands-on support. And we've had this sort of gap in care needs when it comes to people just needing more socialization, support, more companionship, more just like helping run errands. And one of the great resources that we now have in Atlanta is Neighbor Force. And I don't know if y'all want to raise your hand if anybody has used Neighbor Force, but Neighbor Force has a 1 hour minimum up to, I'm sure you could have somebody for 8 or 9 hours, where it's an online platform where you can go and request a companion or a helper or somebody to help do transportation or errands. And the only thing that you have to sign up for, their minimum is 1 hour. And I think the rate is still is it still at $25, Kara? Do you know? Their rate is still pretty low.
I think that's right.
Yeah, so they're
$30 now, y'all.
Thank you. So Neighbor Force now is at $30. So but it's still a really great rate. And you don't have to think, you used to think like we don't have to sign up to do a 6-hour shift because maybe I don't need help for 6 hours. Maybe I just need to go to the grocery store once or twice a week or with light housekeeping. And so Neighbor Force is something we're thinking about hiring support to come into the house and aging in place and really beefing up our support team. If we don't feel like we're really ready for caregivers yet, one idea is to think about hiring a companion through an organization like Neighbor Force. And I want to make sure you all know about it.
Michelle, we have a couple of questions going back 2 slides
Okay.
from Sophie about payment. She asks, how do we find respite programs? And I think that's a really good question because a lot of them disappeared during COVID.
Mm-hmm. So, and I do have to make sure I'm being careful about the language I'm using. So there are respite programs, meaning that there are different nonprofits or even governmental agencies or different organizations who get these pockets of money to help support caregivers. And they're like, great, we're going to support our caregivers by giving them an 8-hour voucher for respite. And then they can use that voucher to then turn around and pay for caregivers somewhere. There's also the term respite that's used when we're talking about assisted living communities who provide a respite stay in their assisted living facility. So sometimes there's assisted living facilities that have a furnished apartment and you can go and stay there for a handful of days or for weeks at a time without making a full commitment to being a resident there at the assisted living. So in this context, what I'm talking about is like those pockets of money. And how do you find those? I don't know. You ask Debbie, you ask Ashley, you ask Jenny, you ask Alice, you say like, have you gotten any emails from, have you heard of any any pockets of money, any grants that have popped up where they're looking for caregivers who need who need some respite support. Like Kara said, they come and go really rapidly. A lot of them did disappear during COVID. And Ashley, what do you think?
I echo what you said, that many of them disappeared during and after COVID. And right now, I don't know of any of those pockets of money other than some that are specific to, that are application based, and not everybody who applies receives it. And it's specifically for folks with frontotemporal dementia. But other than that, I don't know of any of those pockets of money right now. We
What
keep
was
our
the-
ears out, but
Hilarity for Charity used to have some respite grants. I'm not sure if they're still doing that. And then I know
that's
that's
what I was referring to.
Oh, okay. And some of the counties will have money through their aging services program. So again, check with your county aging services and see.
Debbie, would
When there has been money available that needs to get to the right people, Jewish Family and Career Services is often the agency that is tasked with doing that. So it might be worth a call to JF&CS or AgeWell, which is now their clearinghouse kind of service. But I agree, the pockets are few and far between now.
Hey guys, I just wanted to mention, so I know JF&CS will have a new cycle of funding. I believe it will start in July from the ARC. That partnership started during COVID. And I had the pleasure of being a part of that when it was happening and still happening. And then Cobb County has a current respite fund as well through senior services.
Nice. The other question Sophie asked was about long-term care insurance and what happens when you enact it or file a claim. And that depends on your policy, Sophie, in short. Michelle, do you want to speak to that?
Yeah, and it sounds like you wrote in there, Sophie, that I'm hesitant to use it because of long exclusionary period and unsure how it will affect coverage or premiums moving forward. Yeah, it is. I do often see people who put off initiating their long-term care insurance claim. And I think Kara's point is exactly right, that it really depends how your policy is written. And so sitting down with somebody who can review the policy with you and go through the pros and cons about whether or not we should go ahead and use the long-term care insurance. Because how it affects coverage or premiums moving forward. Most policies, once you initiate a claim and the claim is approved, your premiums stop. And how it affects coverage depends on how the policy is written. So if they just give you a certain amount of days once you've initiated, or if they give you a pool of money, some policies are unlimited. I know those policies are very few and far between these days, but some policies are unlimited. So I say we initiate those as soon as possible. In the long exclusionary period, I think you might be referring to the waiting period. So after you initiate a claim, most policies have a 60 or 90-day waiting period before the benefit starts to pay out. And so it might be helpful to sit down and go over the policy with somebody. I know I think most care managers would go over a policy with a person and help them sort through it. Long-term care insurance salespeople or brokers have also been really helpful in the past to sit down and go over a policy and help explain it to somebody, even if they haven't sold the policy to them and they've got nothing financially to gain from it. They understand that they have the knowledge, and usually the long-term care insurance brokers in the area are pretty helpful at letting you pick their brains. And I don't know, Ashley, if that's a service too that the cognitive neurology social workers can do, is sit down and go over a policy with somebody and help them figure it out.
we generally refer them back to the actual folks that they bought the policy from to go through the details, because they're so lengthy. So many of them are so lengthy.
And sometimes if you have an elder law attorney as part of your support team, the elder law attorney can go through the policy with you, because it really can take some figuring out exactly what the policy says.
Michelle, I just wanted to say at IMC, I offer sessions to our care partners, and not necessarily to review their policy, but to provide education about how the assessment process is going to work, what that's going to look like, is it time to activate, et cetera. So that's something that I'm happy and comfortable to do for our people.
Awesome. Okay, very good. So there you go. So you've got some resources here. And Sophie, it's a good idea. It's good that you're asking these questions and just wondering, how do I best take advantage of it? But I do often see people sit too long with that fear and anxiety and not initiate their claims because, and then end up leaving money on the table. So don't let the fear hold you back too long, for sure. And then speaking of money, Kara's going to tell us a little bit. Nope, I'm going to tell you a little bit about daily money managers.
We do have one more question from Sophie about respite services in assisted living. And does that use medical or long-term care, or what kind of payment?
Okay, so the respite services in assisted livings are primarily going to be private pay only, because a long-term care benefit has to be tied with a lengthy service, right? And so they want to see that you're getting this service for 30 days, 60 days, 90 days before they're going to start paying it. So if you're only there for a 3 or 4 week respite stay, you're likely not going to meet the requirement for long-term care, for a long-term care insurance policy. And then on the medical side, there's none of our medical insurances pay for assisted living level of care. And so for the most part, respite stays in an assisted living facility are going to be private pay only. It's a good question. Did you want to add anything to that, Kara? Okay. All right, so moving on to daily money managers. As we're thinking about expanding our support team, one of the things I want you to know about are daily money managers. These are people who are not interested in helping your money make money, and they're not interested in your taxes per se, but they're just there to help you with bill pay, opening and sorting mail, just staying on top of your email inbox, budgeting, organizing paperwork. So sometimes when the day-to-day of financial management and paying your bills becomes too much, or what we often encounter is that there's a couple, and the member of the couple or the spouse who always managed the bill pay and finances ends up getting dementia and can no longer manage that for the household. And so the spouse who does not have dementia, doesn't have the expertise, doesn't have the experience, and is already tapped out. One of the things we can do is add a daily money manager to the team. And there is an association called ADAM, the American Association of Daily Money Managers, where you can go and find a daily money manager in your area. So I just wanted you to know about daily money managers.
So in general, the next few slides are types of assistance that is not direct care assistance that we want you to know about, because one of the things as caregivers, care partners, care providers is that your plate is going to be overflowing all the time. And maybe being the primary care provider is your strong point, and it's what brings you a lot of joy, and having a sitter or a CNA come in does not sound that helpful to you. So that is great and fine, but you still are just one person and you can't do everything yourself. So what are some other things that we can take off that plate so that you're not feeling overwhelmed? These are some general household providers that you should think about. If you don't like cleaning, and there's therapeutic cleaning for your emotional well-being and organizing, and then there's like the kind that is not fun. Consider hiring a cleaning agency. If things are falling apart in your house because the person you're caring for is the one who used to fix everything, consider getting a handyman service. Make sure that you have a lawn care service if that is not one of the things that brings you joy, and feels relaxing to you. And having somebody come and walk your dog that you love so much is also okay. Think about the things that feel like too much for you, and there are definitely service providers who can help with those things. This is Atlanta, and we are resource rich. Meal assistance gets its own slide because it is something that comes up quite a bit. There are a million meal service providers. You probably get flyers for like Blue Apron and others in your mailbox all the time. And those are fine. I think a lot of those are great, and a lot of them provide like a free trial basis. So you might be able to feed yourself and a loved one for free for several months just doing free trials, and that's okay. Just be sure that if you start a trial, you make sure to cancel it so you don't get charged. But some that we have used with our clientele and have found to be particularly helpful are the ones listed on this slide. And there's a lot of different ways you can do this. You'll see the last one is the dinner shop, which is casseroles. If you're into casseroles, you can buy extra, freeze them, and on those days when you don't want to cook, pop them out. If you hate cooking and it is the bane of your existence, do a daily meal one. Or better yet, if you have the resources, there are personal chefs. This is one option here, Vine House and Home, that can come to you and develop a meal plan based on your nutritional needs and preferences. So there really is a lot of options for meal assistance programs. And I don't know why I didn't put on there Meals on Wheels for seniors, but of course, if you are, trying to make ends meet, that's a great option. Available to a lot of people in different areas of the city. Anything to add there, Michelle?
No, that's great.
Okay. Home modifications. If you are really trying to age in place, then it's important to take a look at that house and figure out, do we have as many safety measures in place as possible? And it's better to do this before there's an incident, but many people do it after an incident. But you can request through home health to have an occupational therapist come out. And usually you need to do this in conjunction with physical therapy. So if possible, you can use home health for the home safety assessment, and that will be covered by Medicare. You can also pay privately for a home safety assessment, and Enable Home Solutions is one here in Atlanta that we like a lot. And it's an occupational therapist that comes out and does the home evaluation. But things that you're going to be looking for, or that the therapist will be looking for, is how you move through the house. Are there cluttered areas that need to be cleaned up? Are there rugs or other tripping hazards? Do we need grab bars installed in the bathrooms? If you're caring for somebody with memory loss, do we need cabinet locks for cleaning supplies and medications? Stair lifts, bed rails. Then there's technology that can become a part of the routine depending on your needs and abilities, that can also make the home a safer place. Georgia Tech has some really exciting programs that are helping integrate technology into home safety. And I know you guys recently talked about adult day programs, so I'm not going to say much about this. But that's another really wonderful resource. I'm very partial to adult day programs because it really provides people the sense of engagement, community, and purpose that we all desire day to day. And for caregivers, one of the things that really helps people recuperate from the caregiving experience is expected and scheduled time alone at home. being alone in your own home is cannot overstate the importance of that. And having that sort of time to look forward to on a scheduled basis can really be life-giving and game-changing for a lot of caregivers who are nearing burnout. So again, I won't say much more about that, but if you want me to say more about that, let me know, because I could talk about the benefits of adult day programs all day.
And then I know that we're right at time. The last two resources I want you to know about are care managers and hospice. So care managers like myself and Kara, we're sort of like professional problem solvers that you can add to your team to be your own, in a way, your own private social worker or private nurse, just to help get through a lot of these different issues and just help you. What I always say is that families usually call us when they've been on their own trying to make it work, and then they hit a stuck point and they don't know what to do next. And usually at that point, they call a care manager who comes out, does an assessment, and helps them figure out how to get unstuck and how to keep making progress. We are fortunate in Atlanta that Atlanta is just filled with great care managers. Most of us are members of the Aging Life Care Association. And so you can always go to aginglifecare.org and click on find an expert to find a care manager in your area. And then the last thing we want to make sure everybody knows about is hospice. So hospice is a great addition to the care team and to the support team and help for aging in home. And we usually encourage folks to explore that option and explore that benefit sooner rather than later, but of course, like once they become eligible. But too many people think of hospice as being for just those final days of life. And it really can bring a lot more to your experience and to the support team. And thank you guys so much for letting us speak with you today.
Yes, thank you.
Thank you so much for such a fantastic and for incorporating the questions all throughout. We've answered all those questions, so I'm really grateful to you, Michelle, and you, Kara, for just a fantastic presentation. And we look forward to seeing the audience again next month on the second Wednesday. Thanks so much.
Thank you.
Thank you.